Mechanism of drug absorption. How the drug biotranslocate. How the drug get entry from the site of administration into the bloodstream. So first one is passive diffusion. It is also known as passive transport or passive absorption. So the movement of drug molecules from higher concentration to lower concentration is known as passive diffusion, transport, or absorption. There is no need of energy, no energy consumption here. This transport depends upon concentration gradient. If there is concentration gradient means कि एक रीजन में हायर मॉलिक्यूल्स है और एक रीजन में कम है. So if there is concentration gradient, this transportation will occur. Even this depend upon solubility of medium. So the cell membrane is lipid bilayer. That's why if the drug is more lipid soluble, the absorption by this route will be more, and vice versa. This passive diffusion is further divided into simple diffusion. In simple diffusion, the rate of absorption is equal to dAk delta C by H. This is the rate of absorption by simple diffusion. D is diffusion coefficient constant of drug. A is the surface area of the membrane from which the drug is absorbing. K is partition coefficient constant. Delta C is concentration gradient, and H is the thickness of absorbing membrane. Look here, this is the structure of cell membrane. This outer part of the cell membrane is hydrophilic, while the inner part is hydrophobic region. So the drug will first try to dissolve in hydrophilic region of cell membrane. Then it will dissolve in the hydrophobic region. Again will dissolve in the hydrophilic region, and then will get into the general circulation. This is the site of administration of drug, and then crossing the cell membrane and then crossing into the cell and into the general circulation. Now, if the drug is lipid soluble, this region is more lipid soluble. इस cell membrane में the major part of the cell membrane is lipid soluble and minor is water soluble. So it is very essential for a drug. एक drug के लिए बहुत ही ज़रूरी है कि इसकी partition coefficient मुनासिब हो. Partition coefficient constant mean कि the solubility of a solute in both of the solvent almost equally. This is the one solvent region and this is next solvent region. This is the water solvent region, this is lipid solvent region. So if the drug is properly soluble here as well as here, it means this is of the best partition coefficient drug. इसकी partition coefficient बेहतरीन है. So now look here, the rate of absorption is diffusion constant, is the surface area. Look here, greater the surface area, greater will be absorption. For example, in case of GIT, in the stomach there is no villi, while in the small in the stomach there is no villi, while in this small intestine there is so much villi. So due to this greater villi, क्योंकि इधर ज़्यादा villi है इधर नहीं है, तो इधर सरफेस एरिया ज़्यादा है, इधर सरफेस एरिया कम है, तो इधर ज़्यादा एब्जॉर्प्शन होगी, इधर कम एब्जॉर्प्शन होगी. अगर पार्टीशन कोएफिशिएंट ज़्यादा है तो एब्जॉर्प्शन ज़्यादा होगी. अगर कॉन्सेंट्रेशन ग्रेडियंट ज़्यादा है तो एब्जॉर्प्शन ज़्यादा होगी, रेट ऑफ एब्जॉर्प्शन विल मोर. अगर सेल मेम्ब्रेन की थिकनेस ज़्यादा है, rate absorption will be decreased and vice versa. So the rate of absorption is directly proportional to A, K and concentration gradient, while this rate is inversely proportional to the thickness of the membrane. This is simple diffusion. The simple diffusion is then further classified into number one, convectio transport. This we'll discuss inshallah in next video.